Thank you very much, Mr. Chairman, and thank all of you for being here. And Mr. Johnson, thank you for your efforts and for your work on this especially. And I echo the comments of all of my colleagues here today. We appreciate your courage. Mr. Chairman, I believe this hearing was set for another time, and I requested, and I'm sure others did, that it be delayed so we could have it. It's important to me, and I'm sorry if it disrupted any of y'all or inconvenienced you, but I'm from the state of Georgia. In 2010, there was Amnesty International report that flagged Georgia as being the #1 state in maternal mortality. And that's why I expressed to the chairman, Mr. Chairman, I want to be at this hearing because this is real to me. In fact, when I served in the Georgia State Legislature, and we passed Senate Bill 273 that created the MMRC and put it into the Georgia Department of Public Health. And I wanted to ask you, Dr. Perry, because when we created that, we followed the guidelines and we did what we were supposed to do. But I believe that your group was involved in a study when the state fails maternal mortality and racial disparity in Georgia. So you're familiar with that? And
Sir.
I know you are. And I had the chance to look at it and study it. And one of the things that it pointed out was the racial disparity in Georgia was the fact that even though the 4 categories, access to and quality of care, insurance access and pricing, funding, and accountability around data analysis and use, even though we had those in there, we were still failing on those, particularly access. And my question is, what can we do? Tell me what I can take back to my state, because this is important to me. I served in the legislature. I was Health and Human Services vice chair of that committee, and I helped with this legislation. The point's been made by my colleagues today, what can we do legislatively, but what can I do? What can I take back to the state of Georgia?
Thank you so much. And I do work with Dr. Lindsay and the folks at Grady around the Georgia work, and they're specifically trying to look at their mental health care service structure. So supporting mental health care services in Georgia is important. Supporting Medicaid expansion in Georgia is important. Supporting rural hospital closures in Georgia is important. Like supporting support systems that include midwives and doulas in Georgia is important. All the social structures that we see, all the states where we allow for us to disinvest in women, honestly have poorer outcomes. Even though you can look and do the study and see we have we are working on things inside of hospitals because you have some great doctors in Georgia, you have some phenomenal people and some nurses and midwives, but until we build a structure that holds the entire state together, right? Like from rural Georgia, then we're not gonna be able to see an improvement. And we're being separated around ideals that don't allow us to come together. And it's important that we know we value all the moms in Georgia, rural moms, urban, they all need access to insurance.
Well, thank you for mentioning that, because as you well know, knowing the state, we have a disparity between rural and urban.
Exactly.
I mean, the state of Georgia is Atlanta and everywhere else.
Exactly.
So it really is.
Exactly.
Well, another part of that study that I was very interested in, because I'm a big advocate of this, is the proposition that the state could develop ways to help religious organizations and leadership engage and advocate for quality health education and services. And I'm really big with wanting to include the religious community. And can you give me examples of how we could do that, or examples of how that's worked before?
Including, because if you think about mental health, it's a great example, right? So a lot of religious organizations have access to therapy, access to groups, to places where women can come to make sure they have grievance counseling. So there's been a lot of work that that religious organizations are there to be a safety net and a support for women. They can't replace medical care, but they can serve as a safety net. They can provide transportation, they can help with child care, like all these other things that we're looking for that a community provides, because we know that women who have access to a community and to each other, to connectedness, have better outcomes. So how do we create connectedness and community across this country and across Georgia?
Right. One last question, and this could go to just about any of you, but the thing that I'm wondering here is, I know we're accumulating the data, and I believe you said earlier the data is going to CDC, and are they crunching it, the science of it? I mean, can we tie anything into this genetically, regionally?
I'll chime in, and others. CDC's had a surveillance system in place for a number of decades, and thankfully, we're able to collect a lot of data, mainly coming from death certificates. And just recently now, death certificates now include whether or not a woman was pregnant within the last year, and so that information has been helpful. But what we don't get from all of that, and by the way, that's a voluntary system. CDC asks states around the country to voluntarily submit the data. There are epidemiologists that then review the data, and we learn as much as we can from death certificates. But what we don't understand is that a death certificate does not necessarily tell the full story of how a woman may have died, and what were the underlying causes, and what were the potential interventions that could have been in place to prevent that. And that's what this is about, is taking the data we collect, improving it, improving the collection, making it consistent, having committees that then can design interventions, and having them well-funded so that they can actually see meaningful improvement over time. So that's the difference.
Good. Again, thank all of you, and Mr. Johnson, thank you, and God bless you.
And I'd just like to say that I'm actually a native of Georgia and currently
Did this-
living in Georgia.
did this
It's actually
happen in
happened in
Georgia?
California, but
Okay.
I'm a native of Georgia. Kira grew up in Decatur, Georgia. I grew up in East Point, and we were back living in Georgia, so we
Right.
look forward to working together with you to
Absolutely.
figure out how we
And
help
can
out
I
in
ask you,
Georgia.
was your wife originally from Georgia?
Absolutely, Decatur,
Okay,
Georgia, born and
see,
raised.
this is the point I'm getting at here. We're the cardiac belt. Has anybody looked at any of this to kind of try to tie this into it?
There's a lot of work being done on what is going on that are sort of the underlying causes to why so many women of color, especially, are dying. And there are a bunch of issues. I'll mention one of them. By the way, I'm from Atlanta too. Don't hold that against me.
I see a
it's
pattern
Georgia.
here.
We've known each other a long time. Look, there's a very important study, and we could go through a laundry list of things, but there's a very important study that has really helped all of us understand what are some of the underlying causes of why we see so many disparities among African American women in particular. A study that was done by a researcher who's now at University of Michigan, but she started the study in New Jersey, I believe, where she started to look at this issue of weathering. The fact that African American women's health tends to and African American women tend to have more challenges the older they get. Challenges in pregnancy, challenges in childbirth, challenges maybe post-childbirth, maybe due to this issue of weathering, which is that the impact of chronic stress that may be coming from racism and discrimination over a long period of time, this issue of weathering, which tends to deteriorate one's health, may be a big contributor why we see so many disparities. The fact that women are older as they're getting pregnant, and the fact that if Black women are older having babies and they are experiencing this impact from this weathering effect, that could explain in part why we're seeing so many outcomes. Having said that, we still need to address the fact that we don't simply have to accept that is the case. We can actually do something about it. We can actually address those issues. We can actually deal with the underlying stress that exists. We can actually deal with the systems that may be creating the stress in the first place. And we can make sure that we understand what interventions are really effective across all communities.
Great. Thank you, Mr. Chairman. I yield back.
The gentleman's time has expired. The chair recognizes the